Hello, everyone. I'm Dr. Tanvi. I'm a consultant urologist and robotic surgeon practicing at Cephi and Jupiter Hospital. Today, we are going to talk about benign prostatic enlargement.
What is benign prostate hyperplasia?
What is benign prostatic enlargement? That is BPE. So, in every single male, there is something called andropause, which sets in after 45 to 50 years, which is akin to the menopause in females. So, just the way in females after a certain age, and when menopause sets in, they have hormonal issues and uterine fibroids, etc., happening. Same way in men, once they develop andropause, they develop prostatic problems like benign prostatic enlargement. Sometimes there can also be cancers in the same. What are the common symptoms associated with this disorder?
What are the common symptoms associated with this disorder?
So, usually the symptoms are called lower urinary tract symptoms. The prostate basically surrounds the urethra, it is all around the urethra. So, whenever the prostate enlarges in size, what happens is it blocks the urine pipe, and this leads to symptoms called LUTS. In that, the patient usually suffers from decreased flow, straining, intermittency, a feeling of incomplete voiding. Sometimes they have increased frequency, they may have urgency, and sometimes even urge urinary incontinence. Rarely, they may develop infections or bleeding, and even kidney damage and bladder damage.
How common is benign prostatic hyperplasia in India?
So, BPE basically happens in every single male because it is an andropause related issue, and every single male will go through this phase in their life after 45 to 50 years. However, it is not necessary that every single male will require a surgical intervention for the same. Many men do not develop very severe symptoms and are best treated conservatively. Some men may require a lifetime of a few medicines, and a few males may require surgery for the same.
How is the quality of life affected in patients with benign prostatic hyperplasia?
So, the quality of life is not affected too much. Some patients, along with andropause and BPE, also have sexual erectile dysfunction. They may have retrograde ejaculation due to the surgery, that is TURP, which is performed. But most of these problems are treatable with medicines. And usually, quality of life is not much affected once the BPE is treated. If the BPE is not treated, the patient will have a bad quality of life because they will keep developing infections. They will have urine staying back in their bladder, which can lead to kidney damage. The bladder may become acontractile, and they may also have sexual related issues. Thank you.